I mean, this is rubber. This is like rubber. Yeah, it is rubber.
Hey everybody, this is Dr. C from the Austin Gynecomastia Center answering your questions. Okay, so everyone will sometimes say to me, okay, so I took some hormones and I took some Prohormones and something grew. Okay, and it's real. I mean, I talked to these guys and they went to the GNC, they went to the guy in the gym, or, you know, somehow they got stuff and they took the stuff, and lo and behold, usually like a few months later, boom, you know, you have boobs, you have gynecomastia. And it's a little different. Hormone-induced, pro-hormone-induced gynecomastia is entirely different than the one that you get from having puberty and just never went away. This is different. It's tender. You touch it and it hurts. It could be asymmetrical. You can have these lumps. Typically you have glandular tissue and it's like these lumps, and it's tender. You put a jacket on, it hurts. You put a shirt on, it rubs. If you put a backpack on and it's like, ooh, you know, or if you hug somebody, it can even hurt. So that's a totally different kind of issue. It's sort of a subset of the gynecomastia that we see, but it's actually not that uncommon because there's a lot of people, unfortunately, usually in their younger years, in that high school, college-y kind of thing, that they're looking at their friends and they're trying to be part of this whole kind of like, oh, I'm buffed and stuff. And so you think it's a quick way to get all buffed and whatever, but you can get gynecomastia, and I don't try to touch give you advice on the hormone stuff, and that's for other people, but it definitely is a different type of gynecomastia. It is more glandular. In some cases, just all glandular. And then you say, well, what's the difference? How do I treat that differently? I mean, it's not totally a different operation, but it could be, particularly on thinner people, because on thinner people, there's no fat to work with. I mean, it's just like you got this mass. And so I have to work a little bit harder to sort of make sure it's nice and even, which is funny because the guys who have this are like, oh, this is an easier case. No, it's a lot harder. It's inflammatory. It sticks. It sticks to the downside. It sticks to the top side. It's bloodier. It's more vascular. I mean, it's a whole lot of these things. So the hematomas are more, and you really have to be more careful with this. I use my internal flaps more. I use my quilting stitches more because when I take out a rock, it's just a hole. So I got to use my quilting sutures in there, and I got to get that dead space down. And then I got to make sure these super active people that are used to doing all this stuff all day, take it easy when you're recovering so you don't get hematomas and don't bust out my stitches and all that kind of stuff. So it's actually more difficult for me to treat those pro-hormone induced cases in these weightlifters. I do a fair amount of professional weightlifters and bodybuilders and all this kind of stuff. And again, I'm not giving you recommendations on taking that stuff that's beyond my realm. Please seek out a board-certified endocrinologist if you really want some serious input on this stuff. But the idea of trusting the guy at the gym, you got to be really careful with that whole stuff. Just remember, I have a big, how would you say? I got a big concern with hormones. They're powerful. It controls the human body in a lot of ways. So don't be so cavalier about taking hormones. It's just pretty serious stuff. If you could work it out the old-fashioned way and try to resist these hormones that everybody's taking. But it is a little bit of a different case to treat, and I have a lot of videos you can watch on hormone-induced gynecomastia.
Well, this is normal fat, okay? There's nothing underneath here. This is normal dermis, so this is going to come back here. I'm going to suture that together, and voila. I mean, that's just awesome. That's a nice flat chest. We know we had the whole mass removed. Here it is.